Hi everyone, welcome to First Aid Pro's Basic Life Support Overview. My name is Alan. I'm the owner and head instructor of First Aid Pro, a proud training partner of the Canadian Red Cross. And today we are going to be going over Red Cross's CPR AED for healthcare providers, now formerly known as Basic Life Support. A friendly reminder that these videos are for educational purposes only and are not certifiable. To get certified, please contact us directly so you can schedule an in-person training with our team. These videos are not intended to be a substitute for professional advice and treatments provided by healthcare providers. If you think you or anyone else are in a medical emergency, please go to the hospital, contact your doctor, or call 911 immediately. By now, you should have received an email from us with the attachment for the basic life support flowchart. What the flowchart entails is Red Cross's patient assessment model, meaning regardless of what you have, whether you're by yourself or a team of first aiders in a dental office, if you approach it the same way every single time, whether you have a diabetic emergency, a fainting patient, or a patient in fact in cardiac arrest, if you approach it with check, call, and care, it will always give the quickest and potentially best result for any situation that you have. So what we're going to be going over next is we're just going to be breaking everything down step by step with check, call, care. All right, now let's get straight to it. With regards to check, call, care, the very first thing that we want to check is we want to check for scene safety. Assuming that the scene is safe, the very next thing that we need to check is we need to check our patient's level of response or level of consciousness using the acronym AVPU. A-V-P-U. A simply stands for alert. First thing I want to do when I enter this room is I want to call out to my partner or my patient. Hey Bob, how's it going? If Bob responds, then I know he's alert. However, if Bob does not respond to me calling out their name, then I want to get a little bit more invasive and a little bit more aggressive. V just stands for verbal, which means I just get a little bit louder. I maybe yell out their name or maybe make a little bit more noise. Hey Bob, can you hear me? Can you hear me? If Bob responds to that, to verbal stimulus, that's great. However, let's just go down that list. If they do not respond to the verbal stimulus, P is almost a double P, pressure and or pain. Realistically speaking, what we would like to do next is we want to give a pressure stimulus. So what I would do is I give a little shake on the shoulder. Hey Bob, can you hear me? Can you hear me? If Bob responds to the pressure, again, that's great. However, if they do not respond to the pressure, now we can give what's called a pain stimulus. There are two ways that we recommend giving a pain stimulus. First option is what's called a sternum rub. Essentially what that is, we drag our knuckles rather aggressively onto this patient's sternum to elicit a response. Another alternative, less invasive to the public's eye, is what's called a trap squeeze. Essentially what I'm doing is I squeeze harder and harder and eventually as hard as I can. Best case scenario, I squeeze as hard as I can, patient responds to the pain. Worst case scenario, hey Bob, how's it going? Bob is not alert. Bob, can you hear me? Doesn't respond to verbal. Bob, can you hear me? Doesn't respond to pressure. Squeeze, squeeze, squeeze as hard as I can. Doesn't respond to pain. By definition, the patient now is unresponsive and or unconscious. Once we've determined that the patient is unresponsive, we would like to get this patient onto the floor as quick as possible, but also taking care of our back. So if there are other people in this room, before I get them to call 911, I would ask them for help to help me get this patient onto the floor, onto their back. Okay, now that we have the patient flat on their back on a hard surface, the next thing that we need to check is we need to check our patient's A, B, and C, airway, breathing, and circulation. A for airway. Right now, if the patient is flat on their back, their mouth will most likely be closed. In order for me to confirm that there's nothing there, I need to make sure I'm looking in the patient's mouth. When we look in the mouth, there are two potential options. Either there's something there or there's nothing there. If there's something there in the patient's oral cavity, we are finger sweeping it. If we have suction available to us at a dental office, I can use that suction as well. Option B, we look in the mouth, there's nothing in the oral cavity, I can only assume it's now clear. I now further secure their airway using what's called the head tilt chin lift. The head tilt chin lift, two-step process, the head tilt and the chin lift. The tilting of the head back will open the patient's airway. The lifting of the chin up will pull the tongue away from the back of the throat. And if you do it in conjunction, it now secures the patient's airway. Once we've secured the patient's airway using the head tilt and the chin lift, it's now time to move on to B for breathing. When we do the breathing check, it's important that we do three things. We need to look, we need to listen, and we need to feel for a breath. All three things have to be present in order